Good morning to all. I am Gabriela González Olvera, and first I would like to thank the organizers for inviting me to this talk. I am going to be presenting the surveillance of insecticide resistance and operational research with Aedes aegypti in Mexico, with emphasis in the experience from Yucatan state. Before I begin, I would like to acknowledge the contribution of the following colleagues to the work I will be presenting. This is a large collaborative effort that involves the Federal Ministry of Health of Mexico, the State of Yucatan Ministry of Health, the CDC, and the Universities of Yucatan and Emory. I will start this talk by pointing to the epidemiological and entomological reality of Mexico. With a total of 32 states, Mexico is one of the top countries in the Americas with respect to the number of human dengue cases it reports. The figure on the left shows the dengue case counts during 2000 to 2012 and shows that most of the country, with the exception of the center and north municipalities, have reported cases. This is in big part explained by the widespread distribution of Aedes aegypti as it is shown in the map of the right. As a consequence of the high human health and economic toll of dengue and other Aedes-borne viruses such as chikungunya and Zika, the Federal Ministry of Health, under its Center for Disease Prevention, CENAPRESE, established a state-of-the-art surveillance platform for the capture and management of entomological and epidemiological information. This online decision support system has four main modules, which include surveillance of Aedes aegypti using a network of ovitraps, the regular monitoring of insecticide resistance in Aedes aegypti, the detection of dengue, chikungunya, and Zika from field-collected adult mosquitoes, and the surveillance of other vector species such as kissing bugs and ticks. The overall goals of the platform are to use the entomological information to monitor the impact of vector control actions, provide information to guide where control should be tailored, therefore increasing the efficiency of the program and also rapidly detecting the occurrence of insecticide resistance, and use such information to guide the purchase of insecticides to maximize the effectiveness of interventions. I will describe two of the components, the ovitrap surveillance and insecticide resistant monitoring modules of the system. Mexico has perhaps one of the most comprehensive entomological surveillance programs for Aedes aegypti. A network of 230,000 ovitraps located in 32 states and 712 cities are monitored weekly for the presence and number of Aedes aegypti eggs. Such data are routinely used to quantify the density of vectors and to identify areas of high entomological risk for arbovirus transmission. When looked over time, the ovitrap data also allows the Ministry of Health to evaluate the impact of interventions deployed locally, for example, ultra-low volume applications from vehicles within a city. And finally, the ovitraps provide eggs for evaluating susceptibility of the local population to insecticides. This image shows the entomological surveillance platform in action. The dots show the individual ovitraps, which are ranked by color according to the density of Aedes aegypti eggs. Red indicates the highest quartile in the number of eggs for a city. The buffers show a 100-meter area around each positive trap on a given week. Finally, the small red circles show a 100-meter buffer around the location of human cases detected on the same week as the ovitrap monitoring data. Therefore, the Ministry of Health staff can use these risk maps to guide where intervention should be performed. A recent innovation in the entomological surveillance of Mexico has been the establishment of Bioassays units. There are currently 22 units have been staffed by hearing biologists and entomologists who are in charge of rearing Aedes aegypti from ovitraps to have enough female mosquitoes to conduct bioassays. Conduct the standardized CDC bottle bioassays using a list of molecules of all insecticides approved for public health use in Mexico, and conducting these activities every 2 years to inform insecticide procurement. I am responsible for one of these bioassays units, the one in Yucatan state where the arrow points. Another strength of the program is that all guidelines and procedures are openly available to the states and the public in general. On the left, you can see the latest manual for insecticide resistant monitoring that the Federal Ministry of Health generated. In the year 2016, Bioassays units conducted the first national assessment of insecticide susceptibility in Aedes aegypti, which was published in 2017. I will be reporting findings from this paper, which constitute the latest and most detailed characterization of Aedes aegypti susceptibility in Mexico. These maps show all the localities evaluated as dots, and with colors the results from the CDC bottle bioassays ranked by the WHO convention used to characterize resistance to insecticides. In the map, the red dots indicate mortalities below 90%, which suggest resistance to the active ingredient tested. In yellow are localities where mortality was above 90% and below 88%, considered as indicative of potential resistance. Finally, localities in green indicate susceptibility to the active ingredient. As you can see from the two figures, in the year 2016, Aedes aegypti was fully resistant to type 1 pyrethroids, in this case, permethrin and bifenthrin. Type 2 pyrethroids did not show the high level of resistance as type 1, but the agreement is that resistance is widespread with only a few foci of susceptibility. Given the high level of pyrethroid resistance, Mexico used this information to phase out the use of pyrethroid insecticides for the control of Aedes aegypti. Other insecticide groups, such as organophosphates, also showed widespread resistance, but not as high as for type 2 pyrethroids. Finally, given their limited use, carbamates are still a valid option given the almost absence of resistance in Aedes aegypti. The latest assessment of mechanisms of insecticide resistance at the national level was conducted for pyrethroids by Adriana Flores Group, which characterized the rapid increase in KDR mutations in Mexico from 1996 to 2008. As seen in the map, the red bars increased dramatically compared to previous years, indicating a rapid increase of the KDR mutations in the position 1016. In the city of Merida, the increase was very pronounced and led the Ministry of Health to phase out the use of pyrethroids to control Aedes aegypti starting in the year 2016. This large-scale pattern of rapid and widespread evolution brings up important questions about the reliability of pyrethroids for mosquito control. Specifically, with colleagues from the Collaborative Unit of Entomological Bioassays from the University of Yucatan, Dr. Pablo Manriquez Aide, and from Emory University, Dr. Gonzalo Vázquez Procopec, and from the Federal Ministry of Health, Dr. Fabián Correa Morales, we were interested in two specific questions regarding insecticide resistance in the state of Yucatan. The first one was, at a finer scale, which means within the state of Yucatan, how is the distribution pattern of pyrethroid resistance and KDR mutations in Aedes aegypti? And the second was, given pyrethroid insecticide applications, were phased out since 2016 in Yucatan, what drives the maintenance of high levels of resistance and KDR mutations? We conducted a study in 2016 to address the first question around the city of Mérida in Yucatan. The premise of the study was to quantify the fine-scale variability in phenotypic and KDR resistance to pyrethroid within nearby towns. The hypothesis being tested was that if pyrethroid resistance and KDR frequency followed the national trends shown earlier, all endemic towns within the region should have similar trends in resistance. When phenotypic resistance was quantified, marked variability was found, with no specific trend in which town would have high susceptibility given its prior history of dengue transmission. As the figure shows, for instance, Progreso and Concal were closer to each other yet showed marked variation in the percent mortality of Aedes aegypti exposed in CDC bottled bioassays. Even further, both KDR mutations, the alleles in position 1534 and 1016, showed significant and marked variability among cities, with tests of genetic differentiations identifying lack of homogeneity in their distribution. To investigate the geographic pattern of variability in KDR even further, we selected one of the towns from the previous study called Unucma, which showed phenotypic susceptibility to delta methrin, and investigate the microscale pattern in KDR haplotypes within randomly selected city blocks. The hypothesis of the study was that, given there was not a strong signal in resistance when the entire town was characterized, KDR haplotypes should be similarly low at the microscale. Aedes aegypti adults were collected indoors with Procopac aspirators and individually tested for KDR mutations in the 1534 and 1016 positions. Haplotypes combining both mutations were generated. This map shows the double-resistant haplotype for both KDR mutations. The study was conducted on the dry and wet season of 2014 to 2016 and covered 4 collection periods. As it can be seen in the map, the pattern of KDR distribution was contrary to what was hypothesized. In 2014, rates of the double mutant 1534 and 1016 haplotype were highly variable within the town, ranging from 0 to 80% within less than 500 meters. Even more interesting, as the wet season ended, the upcoming dry season showed a rapid increase in the haplotype frequency throughout the city, even in the absence of pyrethroid used by the Ministry of Health. The wet season of 2016 showed reduced frequencies compared to the previous dry season. The dry season of 2016 showed almost invariant rates of the double-resistant haplotype. This study allowed us to conclude that even in the absence of pyrethroids for mosquito control, rates of KDR change as a function of the seasonality of mosquitoes. Other factors may be operating and may help explain why pyrethroids resistance and KDR haplotype frequency vary both in space and time. This led us to investigate what we hypothesized was a probably driver of KDR variability in the absence of their use by the Ministry of Health. Household aerosolized space sprays used to control insects. A study conducted in Yucatan characterized household expenditures in commercial aerosolized insecticides and found that the most common insecticide inside houses are aerosol spray cans, such as Raid, which contain a mixture of pyrethroids like V-alethrin and phenolphthalein. People reported using such insecticides primarily for flying insects at a daily or nearly daily frequency. The benefit they see in using these products offsets their cost, which ranged at about $30 per year. Given this high reported use, we hypothesized that it could be that the high frequency and heterogeneity in KDR within cities may be reflective of variability among households in commercial insecticide use, and that such insecticides may be an additional and a strong pyrethroid selection pressure on Aedes aegypti. To investigate that, we conducted studies in 2018 in experimental houses located in Mérida. These are regular uninhabited houses that UCBE rents long-term for conducting insecticide evaluations and population ecology studies. Specifically for this study, we used individual bedrooms as the unit of experimentation. So we placed mesh enclosures with mosquito to make sure that they would get exposed to the insecticides, and then applied the aerosolized space sprays as directed in the level. And this involved applying in the room the insecticide at a 45-degree angle for 10 seconds, then closing the door and counting mosquitoes, knockdown, and mortality after 20 minutes exposure. The study was repeated using 3 strains with different levels of resistance, collected from the towns we evaluated in the previous study. All dead and alive mosquitoes were individually tested for the KDR mutations 1016, since previous studies found that the mutation 1534 was presented in 98% of the population. As it can be seen in this plot, when a susceptible Aedes aegypti strain was used, the insecticide killed 100% of mosquitoes. However, when a pyrethroid-resistant strain from one of the towns evaluated before was used, mortality was only 30%. This strongly indicates a significant decline in efficacy of the product due to the presence of resistant mosquitoes. Now, we wanted to know if those mosquitoes surviving were resistant or perhaps just did not get impacted by the insecticide. Our findings clearly show that the mortality in the resistant Aedes aegypti strain was a function of their KDR frequency. And genetically susceptible mosquitoes were almost fully killed by the application. However, those mosquitoes that were homozygous mutant for the KDR mutation 1016 showed a mean mortality below 25%, indicating a differential selection of the insecticide in favor of resistant mosquitoes. A logistic regression confirmed that, showing that the odds of a resistant mosquito surviving compared to the homozygous susceptible was 0.06, whereas for a heterozygous resistant, the odds was 0.25. In fact, for the 3 pyrethroid-resistant mosquito colonies used, the frequency of the isoleucine allele in the surviving mosquitoes was significantly higher than in the dead mosquitoes, reaching values ranging from 75 to 80%. This, again, is proof that the household aerosolized insecticides are selecting for pyrethroid resistance, and also that removing pyrethroid from public health will be unlikely in reverting pyrethroid susceptibility in the region. In conclusion, Mexico's state-of-the-art monitoring program provides useful information to guide decisions of insecticide procurement and management of insecticide resistance. Insecticide resistant monitoring should be conducted at multiple spatial scales, country to within city, to understand the spatio-temporal scale of selection. Particularly for pyrethroids and KDR, household insecticides may be critically relevant in explaining the lack of restoration of susceptibility years after they were phased out from vector control programs. I would like to thank all the people and founding agencies that made this research possible. And again, thanks to the organizers for this opportunity. And here's my email if anyone would like more information. Thank you.